I now invite the first speaker, Dr. Mahesh Desai from India, to speak on leadership in urology. Over to you, sir.
Good afternoon, and thank you very much for the kind invitation. I'm going to speak about the leadership in urology, a role of growing social media. It's not easy to become a leader. It's a lifelong process to become a leader. And what you require is the inspirational growth. The leadership in urology, as in any medical specialty, is crucial for advancing patient care, promoting research and innovation, and shaping the future of the field. The ability to combine personal qualities with the relevant knowledge and experience to form an opinion and make a decision is the core exemplary leadership. And for that, you need a growth plan, knowledge acquisition, purpose, education, career development, training in a special institute. Then, to fulfill that, you need opportunity, passion in life for growth, and challenges and courage. I had my inspiration from my mother, and she wanted me to become a doctor. Unfortunately, on 31st July 1961, before I got into medical, she had a complication of surgery and she died. And that time the doctor said it is 1 in million complication. For me, it was a 1 in 100. And that day I decided I want to become a doctor. And then I will make sure the complication, if possible, I can avoid it. I got admission to medical, and then we did my MBBS, and then I had done MS, and I had a mentor, philosopher, and inspiration in Dr. Bode, who stimulated me. But that was not enough. That was the basic knowledge acquisition I did. I had to do the skill development. I went to England to fill in the gap of the knowledge as well as to develop the skill. And after developing skill, and I got FRCS from Edinburgh and London, I came back and started a small nursing home. Patient-centered care was my aim. The effective urological leader prioritizes the patient care. They advocate for the best interest of their patient, ensure that the treatment are evidence-based, safe, and a patient-focused. And private nursing home is not a place where you can do what I learned. I changed to Muljibai Patel Urological Hospital that was being built by Dr. Virendra Desai, who was my registrar in England. And then we started that immediately in 1978. Moment we started, we did two dialysis machine, only dialysis facility in Western India, and we had a patient better. Now what? We started to do a kidney transplant. But for planning, we needed a planning for that. We sent our nephrologists and pathologists to Denmark to get more training. We took technician, Virendra Bhai took technician to get a little bit more care. We developed a urological team, and then we did a transplant. And then we had some success, we had some problem. Success was such that one patient lived for 27 years. But the problem we have to face, as somebody said, you have to look at your complication and work on it. And I went to spend 1 month at Downstate Medical Center in New York to look at the ureteric complication that time. And that time I attended the SAUS San Francisco and listened to the lecture by the Christian Chaucy and Peter Alkin on ESWL, PCNL. At that time, Virendra Bhai had undergone a bypass surgery and he also died. And then friend, philosopher, and guide, fearless, daredevil surgeon who taught me lots of things. And man with a conviction, vision resulted into an establishment of MPH, which is giving a world-class care. And that time, the problem was the leadership need to be revived. So on 30th January, 2 months after his death, I did the 11th transplant. Revive the confidence and the trust in commitment to the staff and the institutional people. Intention was to create a center of excellence for the patient care. I had a confidence, humility, intensity, and courage. Vision was every life deserves world-class care. And create a confidence, trust me. That was the story. And I worked on transplant, and at the end of so many years, now we have, from 40, we have a 95% 1-year survival, and 5-year survival is 60%. And the complication has gone down from 19% to the 5%. And this patient had a transplant in 1983, and after 38 years, he's with the family. And that's the reward you get when you work on the patient. The leader in urology set a high standard for the clinical practice. They are knowledgeable, skilled, keep up with the latest advances in the field. They often serve as a role model to other urologists. I picked up the PCNL, which I heard in San Francisco in 1985, and I was the third one in India to do the PCNL and the first one to do a ureteroscopy. I picked up the ultrasound because I thought ultrasound was a better thing. So, you got to have an open mind to pick up the new technology. And I use ultrasound. I use ultrasound in everything. And then I found it first, I used it for ultrasound-guided puncture to the kidney. But then most important was that presenting your work in a national and international conference, you present. But what is important, you listen to the comments. You listen to the criticism. You take a note, see what other people have presenting. And that gives you a more knowledge and everything. Then I came and then tried to do challenging cases, which were difficult to do by PCNL, and that presented. Research and innovation. Leadership in urology involves a commitment to research and innovation. Leading urologists are often involved in a clinical trial, research project, development of new technique and surgical technique. I did a Dattler stone to prevent the stone migration, micro-perk, then the mini-perk with suction, then thulium laser, then the CAVAC armamentarium. This is the ureteroscopy with the suction, which we are working at this moment also. Disposable scope, ureteric sheath with a suction, and that will advance. So urology is the field that continuously benefit from the advance in technology. From open surgery to endourology surgery to laparoscopic, robotic surgery, we picked up everything one by one. And today we have done more than 33,000 stone treatment and utilizing all the technology which is available. But what is most important, as somebody spoke about the education and training of the next generation of urologists. And we had Dr. Bapat and Vidya Acharya is a urologist and nephrologist to train our students. And then this is a center which we did, a Jairamdas Patel Academic Center, where motto is enter to learn and exist to serve. And here we have an auditorium, the knowledge retention by lectures, by reading, by audiovisual demonstration, and then you have the discussion of the group, practice by the doing it on a dry lab, teaching others, that gives you more knowledge, and then the workshop, and then the PCNL, a low fidelity module, PCNL and live animal surgery, and then the flexible ureteroscopy on virtual modality, laparoscopy on cadaver animal, the live animal, TURP on low fidelity, TURP on virtual reality. But we had an ideal training scenario. You work on the skill development, you work on the animal, and then you go to the patient to do that. And that's how create expertise in the urology. And we had a robot training. We are now giving. Now, urologic leaders are recognized the importance of continuous learning and professional development. And we have conducted so many conferences in Nadia, then the Video Urology Conference, International Conference in Goa in 2000, WCE 2004 in Mumbai, and the Segura Urolithiasis Score in 2013, Semilive in 2020. And this organizing conference gives you the insight. The new technique which comes, laparoscopy or a single port or HIFU, or histoscan, then we did an aquaablator, we also did a flexible robotic system, we did a clinical trial. All new technology we have adapted. We have trial. And the urological leaders are often involved in the quality improvement in initiative within their healthcare institute, and we been recognized for the quality care thing. But it is not enough to treat your own people. The people suffer from all over the world. And we have the thing to global spread of knowledge. I adapted Nigeria in 2012 and controlled it. I went to Moscow, operated on Nairobi, I done Sudan, Bangladesh, and Egypt. And then I realized the communication is very effective. Leadership in urology requires a strong communication skill. Urologists need to communicate clearly with the patient, their family, colleagues, to ensure that everyone is on the same stage regarding diagnosis and treatment. We did so many courses in JAPAC, 123, 9,150 attended. And SIU, we started doing the webcast. And there are 12 courses and 20 countries, including some of the SAARC countries, Nepal, Bangladesh, Pakistan, everybody attended. We did a 283 publication, 30 book chapters, and we have trained 136 students. And they have spread all over India, spreading the knowledge and making sure the patients are treated to the best of their ability. Offer you a strength to others. Offer your strength to the others, and you shall be amazed how many people offer their strength to you. We had alumni, and they have learned the transplant. We have done about 4,000 transplants so far, 300, 900 transplants. But a whole team, if you combine, they have done 9,000 transplants. 9,000. And India needs more than 2 lakhs transplants a year. And this is how you spread, and that's what we have done. So you need to have a collaboration, professional organizations like the WCE, AUA, SIU, SARC country, AUA, and you should have ethical, highest level of professional integrity and technical integration. Of course, when you do this, you are awarded a BC Roy, St. Paul Medal, SIU President, World Urology President. But what is most important, patient, they get a problem, they come to you, and they be treated. But what about the patient who don't get a symptom, but they have a disease, and you got to make them patient aware. So we can use the social media to make awareness of the patient. You make a video and make a awareness of the patient. So lastly, what is most important is a lifelong learning and teaching. Even today, at the age of 80, I learned quite a bit in the whole morning session. And what is important is urology leaders recognizes the importance of continuous learning and professional development. They attend conferences, read scientific literature, engage in ongoing education to stay up to date with the latest development in the field. Leadership in urology is not limited to one specific role or position. It can take various forms, including clinical leadership, academic leadership, organizational leadership within the healthcare institute or professional society. Ultimate goal of the urological leadership is to enhance patient care, advance the field, and ensure the urologists are well prepared to meet challenges and opportunity of modern health. The Chanakya who said, no one can defeat a powerful mind. Your patient come first. People in power must be accessible. Hold people accountable for their work. Don't delay your decision. Do the right thing at the right time. Every life deserves a world-class care. And for the student, enter to learn and exit to serve. Thank you very much.